So what do we have? We have the decreased straight leg raise. It's significantly different. And I'm feeling tension through here. Oh yeah, significantly different.
It's funny because this side feels more tight.
And tightness on the inside of the hip. And then you have this prepatellar bursa. Sometimes you can get cysts that balloon as well. Let me know which one is.
Just like 10 inches off?
Yeah, no, it's like 2 or 3 inches off. Yeah. So you'll just lift like this, like one and the other and the other. And then you just tell me which one is easier to do.
The right is easier.
The right is easier?
The left feels lighter.
Okay, and then the left, when you tighten your abs, and then when you, and you can do it this way too. When you do it that way, what is it? Easier?
Yeah, it is easier on the left with that support.
So I'd say, the transverse abdominis is inhibited predominantly on the left side. So what I would do here, because my goal would be improve the stability on the left side and see if we can get some contraction on the VMO. But the question I didn't ask you, you've had treatment of some kind to get
jammed needles into this with e-stim and I can barely get a contraction. It has gotten better in the last month, but I think you said in one of your lectures that it would feel pinchier with e-stim on severely inhibited muscles, and boy does that pinch with e-stim.
Yeah.
So the other tiny bit of activation.
The other thing that I would do, whenever it's very difficult to stimulate a muscle because of atrophy or inactivation, try to go to the trunk of the femoral nerve in this case. So that's the one thing maybe you haven't tried that I would, because when we do that, we're stimulating all the muscles innervated by that nerve, right? So that's what I would do that's different. Then of course I would go to the VMO, and I'll still do that. I'll go to the VMO and see what it does, where we find, and I don't want, I don't want you to try this if you haven't practiced it or learned it, but we find the femoral pulse, right there, because it goes vein, artery, nerve. I'm on the artery, so I go just lateral to that, and that's the nerve, okay? And I'm not going to insert deeply. I'll turn this down, and I'm going to add a pulse in here, see what it shows. There we go. See that? Yes. So that's perfect. So we can see that. So that's stimulating everything. So this is really good. So what I'm going to do now is I'm just going to get the stim, low frequency, enough to get the contraction. And that's really going to help you with your, like when you do like VMO exercises, it's going to be like totally different.
Thank you.
You okay? I don't want it to be painful.
It's not.
No? Sure? And what I'm going to do is I'm just going to increase the frequency, because the goal is different now. It's not neuromodulation for pain. I want to get muscles. I want to get stimulation. So I'm going to get close to 10 hertz. Is that all right?
Yeah, just weird.
So this is the e-stim. I like this machine. It only has 2 leads, but I like it because a few reasons. One, when we learn on Sunday high frequency, I can get to 100 hertz right away. There's a 100 hertz dial. There's a 10 hertz dial. And the wires are thicker, so it gets a crisper, deeper stimulation, and they don't break as easily. Is that okay?
Yeah.
I'm just going to leave that with you, okay? All right. You're welcome. All right, few minutes.